Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. John Kaddis this morning. He's joining us here from City of Hope to talk about a recent study from City of Hope, which found that cells that control blood glucose levels from deceased chronic marijuana users fail to reverse diabetes at a much higher rate than from those who didn't use it. Welcome to Health Professional Radio, Dr. Kaddis. Thank you.
Hello, Neil.
Well, give our listeners a bit of your professional background and talk about your role at City of Hope briefly.
Sure. So I earned my Ph.D. from the University of Southern California, and that was in systems biology and disease. My background and training is in analytical chemistry, informatics, statistical genetics, pathology, and medicine. I put all that together here at City of Hope, where I am an assistant professor, and I am studying how type 1 diabetes develops and trying to identify different therapies to combat the disease.
Now, as far as how type 1 diabetes develops, what are some of those aspects, and what types of treatments have you been looking into?
There's a lot of different things that we are appreciating and understanding about how the disease develops. Essentially, the immune system turns on these cells that make insulin for the human body. And so that attack is one of the causes of what happens in type 1 diabetes, which is essentially a loss of the ability to produce insulin and hence control blood sugar levels. And there are lots of different treatments, from different medications that you can take to different immunotherapies that we are looking at here at City of Hope, and also different strategies where you can implant these specialized cells called islets that make insulin, and you transplant them into the human body. So there's a variety of different things on the horizon and also happening now.
Now, where do these, you say islets?
Yes.
Where would the pancreatic islets, that's the only place where they're transplanted?
Yeah. Okay. So, that's not the place where they're transplanted, but that's the place where they live. So if we take a step back and we look at the human pancreas, and that is a very complex organ. It's responsible for many things. Not only does it make insulin, but it also makes other hormones that help you control your blood sugar levels. But it does other things as well, too. It helps you with digesting different foods that you eat throughout the day. So the pancreas is responsible for a lot of different things, but related to the question about transplanting the organs, curiously, you actually don't transplant them back into the pancreas. You put them in other regions in the body, and there are reasons for that scientifically, but transplanting them is something that's done, but it's done in different locations in the body.
Does lifestyle play a huge role in deciding who is a candidate for these transplants, as in many other transplants like heart, lung, or kidney?
Not largely. What mainly drives who can be a candidate for transplantation, at least currently, one of the criteria is how brittle their type 1 diabetes is. In other words, how well they can control their type 1 diabetes with insulin, for example. And there are many people that, despite their best efforts, have a very hard time controlling their diabetes, even though they're doing all the right things. They're taking their medications, they're watching their blood sugar levels, they're doing all of these different things, but it's still very difficult for them to control their blood sugar levels.
Now, the study concerning chronic marijuana use in deceased patients, why was that study conducted? What prompted it?
All right. Yeah. So to understand why that study was conducted, we need to step back a bit. And as I mentioned to you, the pancreas is a wonderfully complex organ. It's also very difficult to take apart. But here at City of Hope, we have a laboratory that's dedicated to essentially dissecting the human pancreas and taking it apart into its component cells. Now, Dr. Ismail Al-Abdallah leads that effort. And what he and another investigator, Marijane Q, noticed is that when they would have these human pancreata in their hands, they would notice that it looked different. It didn't look like pancreata from individuals that didn't have, that didn't use marijuana at all. And that got them curious. And that's where the story actually begins, is when they noticed this and we started talking about some of these differences.
Are these differences present whether the person is using smoking or vaping or using edibles? Does that even matter? Or is it just the consumption of the THC?
So that's where the story picks up at. So what we did is we went back and looked at individuals that had no evidence of marijuana use in their lifestyle. Then we looked at individuals that had infrequent use of marijuana, and that could have been anywhere from 5 times or less in a year to even 2 or 3 times a month, and we called that infrequent use. But then there were individuals that had chronic marijuana use, and these were individuals that were using it anywhere from 3 to 4 times a week or more for 3 or more years. Now, alongside that, Neil, what we also did was we looked at evidence of other drug use as well. Now, because we were looking at medical records and we don't have access to medical records across their lifetime, it's going to be limited by what we know about that individual when he or she, or more appropriately said, when the family member of that individual shares information with us about that individual's lifestyle. Mm-hmm. So we essentially quantified the number of people that were chronic marijuana users versus those that weren't. And then what was done was we actually started looking at these specialized cells that are called islets, and they make insulin. They also make a number of other hormones. And what was really fascinating and still exciting today is that when we took those islets and when we transplanted them into mice. Now, the reason why we would transplant them into mice is because these mice give us an opportunity to study diabetes. And so what we do is we take mice and we make them diabetic. So we essentially try to mimic what we might see in a human. And we transplant these islets into a mice. And now normally what would happen is when you would take these islets that are working really good in the human body, transplant them into mice, they would have the ability to reverse diabetes. But what was fascinating was in this study, when you took those chronic marijuana islets, transplanted them into mice, they failed to reverse diabetes.
Now, how do the results of this study, I guess, change how we think or approach screening criteria for donors? I asked about lifestyle earlier in our conversation. How does this change our thinking when it comes to chronic marijuana use and transplants of this type?
Yeah. So one thing I will caution is that we looked at chronic, so continued and frequent marijuana use. We don't know about individuals that may have used marijuana once or twice, but this is again looking at chronic marijuana use. And here what we can observe and what we can apply is that chronic use is detrimental to human islets. Chronic marijuana use is detrimental to human islets. And so that's one thing I think we can say from this study. And that means that we need to pay attention to lifestyle. If individuals already have a hard time producing insulin in the body. Will chronic marijuana use affect that? This study didn't directly address it, but I think it's giving us a very good hint that perhaps chronic marijuana use is going to be something that we should steer clear of.
Give us a website where we can learn more about this study and about City of Hope, if you would.
You can actually go to the City of Hope website, and you can view that yourself. And so that is going to be found at cityofhope.org, and you'll learn. You can learn more about this study, and also learn more about what my lab is doing and what other labs are doing within our Diabetes and Metabolism Research Institute. Because one thing I didn't tell you is that we've got a very large institute, the Arthur Riggs Diabetes and Metabolism Research Institute. And so we have many people here who are investigating not only type 1 diabetes, but also type 2 diabetes and the interplay between diabetes and cancer.
Well, I appreciate you joining us here on the program this morning. It's been a pleasure speaking with you, Doctor. Hopefully we'll speak again.
Thank you very much, Neil. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. John Kaddis. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.